Are you suffering with chronic lower back pain or struggling through flu season? What if there was a way to help ease your pain or get over the flu while being compensated and taking part in groundbreaking medical research?
And here to explain more on clinical trials and how they can help you and also the medical industry, we have Dr. Joe Puzar from Centex Studies. All right, Joe, let's talk about a clinical trial. What exactly is it?
Thankfully for all of us, before a medical product of any kind, be it a drug or an instrument, be brought to market, it has to be shown to be both efficacious and it has to be shown to be safe. And the process by which all that occurs is a clinical trial, and that's what we're doing. Generally, it's a sponsor, usually a drug company, a pharmaceutical company that's working with the FDA. They develop a protocol to demonstrate exactly how the drug should be used and try to figure out exactly what the full side effect profile is. That gets approved, and then we're actually one of the companies that administers that trial.
And Dr. Puzar, you are soliciting what types of people? What age? Who?
Well, it depends on the trial, but a 30,000-foot view is it can be anyone, depending on the trial. Some of our trials allow for patients down as low as the age of 13. Depending on, again, for the flu trials, they can come in at a very young age, 13 and above. Some of our other trials are strictly for adults, for our diabetic and musculoskeletal trials.
So it's basically anything that you would need to take a drug for, because you just mentioned the flu, and then
exactly right.
Potentially go all the way to cancer trials too.
We don't currently do cancer trials, but yes, those are being done out there. Those are usually done more in tertiary care facilities.
But you guys do a lot of like diabetes, and even the run-of-the-mill allergies?
Haven't done allergy trials yet.
Okay.
What if someone has a pre-existing condition? Would they be eligible to participate?
It depends on the actual trial. Some of them allow for pre-existing conditions. Some of them, there's usually some specific things that are excluded. In any trial, there's usually a set of inclusion and exclusion criteria that the person has to meet. They have to have certain manifestations or diagnoses in order to be able to participate, and there are certain things that they cannot have that would exclude them from participating in the trial.
But like something like a flu trial, do you have to have the flu?
You do, in fact, have to have the flu to be in the flu trial. Yes.
Wow. Okay, and how much money can someone make? Is you actually pay people for coming in for these regular checkups?
Yes, it varies from trial to trial as well, but most of the time people can expect somewhere between $50 and $75 per visit, depending on what's involved. Yeah, and depending on some of these trials go on a year or more.
How do you find out about the different trials?
How does a patient find out?
Yeah, how do you find out about it?
Well, they can call us at Centex and inquire. We can give them a rundown of all the trials. It's also available on our Facebook page and website. We can let them know what kind of trials are ongoing at that time.
And also, I think it's important to point out that not everyone would actually be put on a drug in a clinical trial, right? Aren't some people getting placebo?
In most cases. Not all trials have placebos, but probably 90% of the trials that we're doing, especially if they're involving new products, there is a chance that you would be put on a placebo, and that's done to eliminate bias. I mean, there's a very significant placebo effect. If people know what they're getting and the doctor knows what they're getting, there's a natural tendency, I think, to report benefit when maybe none would be there. And so that's why the placebo group is usually present in all these trials.
So when somebody goes into a clinical trial, do you also then work with their regular doctor too?
We at least get their medical records, and if it's important in a lot of trials, like for example, if it's a cholesterol trial, we've done some of those, we usually make sure it's cleared with their cardiologist or their primary care physician if they're okay with them participating in that trial.
And Dr. Puzar, the participants in the study then, what kind of medical care are they receiving over the course of the trial?
Well, there's almost always an initial physical exam and further exams as they go through the trial. There's laboratory monitoring that is done that's usually specific for whatever the particular disorder is that we're looking at in that case. But it's numerous physician visits. It's actually, in many cases, probably more or closer oversight than what they would get if they were being treated. I was going to say, it's more care than I'm getting now.
I rarely go to the doctor.
Well, for somebody that, say, that has diabetes, I mean, that's one of the things you guys are doing clinical trials on.
Right.
I would think it would also just be fascinating, the whole process of going through and then seeing that your participation in this could potentially change something in the medical community.
That's a fact, and a lot of our patients that participate in these trials are doing so partly because they're interested in the process of science, and they want to help in our advancing the medical field.
And Dr. Posar, lastly, if someone gets into a clinical trial and they decide after a few visits it's just not working for them, can they decide to take a hike?
Yes, they can. They can disenroll at any time and for any reason.
That's so interesting and fascinating. Thank you, Dr. Posar, for coming in. And to find out more about Centex studies and how you can get involved with the clinical trials, you can visit them on their website at centexstudies.com or call 281-918-0048 for more information.
And